Thank you so much for that opening, Francis, and for sharing a story about our colleague and really supporting us on this opening day of the Alliance and Partnerships for Patient Innovation and Solutions Summit. And as was shared today, the theme of today is health literacy. And before we dive in, let's take a minute or two to think about what health literacy entails. And there's no doubt that health literacy is an important aspect to a person's ability to manage their health. And oftentimes we think about addressing health literacy simply through information being provided about a health condition and giving that information through a pamphlet or something like that to a patient or caregiver. However, if you listen to what experts say, they tell us that health literacy is not simply about people's ability to get health information, but they also need to really understand it. And when we say understand, experts also say it's not just about the ability to make appropriate decisions, but it's about the ability to make well-informed decisions. And if you look at the definition for health literacy that's been laid out, it talks about the goal of health literacy being so that people can access, understand, and really act on the information and make healthier decisions for themselves and the people they care for. So when we think about making a difference in health literacy, another important element to appreciate is that it doesn't only apply to the patient or to the caregiver that is trying to manage health. And Francis actually just mentioned this. It's about all of the different stakeholders in the healthcare system, healthcare professionals, patient organizations, of course, government, nurses, everyone really partnering to elevate health literacy. And so to help us kick off today's meeting, I'm really excited. We're fortunate to have a very passionate healthcare entrepreneur joining us. And her name is Esther Wang, and she has devoted herself to a really bold endeavor to really try and demystify the complicated and most of the time just unimaginable medical world from a kid's or from a child's point of view. And she's done this by developing a very creative solution that helps children understand the health procedures and in turn, even for children, make better decisions about their care. So I'd like to welcome Esther Wang, please.
Hi, Ruth. Hi, Ruth.
Hi, hey, Esther.
Thank you for having me here.
Good. We're super excited to have you here to kick off our session today and to talk about the work you've done around health literacy and share your journey to create a solution that was very importantly created in Asia, but has gone beyond. So before we get into health literacy and the solution that Joytingle has created for children in countries all over the world, I'd like to go back to the beginning and just ask if you could tell us a little bit about the foundation and how you started down this path.
Right. It started with a volunteering experience. So at that time, I was volunteering in a children's hospital where my university classmate invited me to come because I'm able to do balloon sculpting. If you can actually see my screen, when I was there at the balloons at the hospital, I soon realized a few things as well. Firstly, parents are often ill-equipped to explain medical procedures to children. And naturally, children are afraid, right? So what the parents will usually do is they will either distract them by giving them an iPad and play maybe something on YouTube, or they will pacify them after that with what they call a spoonful of sugar or ice cream after that. There's nothing wrong with all those processes. There's nothing wrong with that. But I felt that it was a missed opportunity to actually explain to a child what's actually happening and educate them and with the right terms. And on a more fun note, when I was there doing the balloon sculpting, if I draw your attention here to this, the fish, what was actually the most popular balloon sculpting item is actually the fish with the fishing rod. And you know what's the fun thing? I'm just going to use my pen to illustrate as if it's a fishing rod. So actually, if you hold it outwards, and all of a sudden, what it does is actually transform the hospital bed into a boat. So now the narrative has shifted. Instead of a patient that is by the bedside in a hospital in circumstances that they did not choose, what happens now is that the child is now fishing out in the sun. And as volunteers, we could now engage the child as a child. We could start ask them, oh, what's your favorite fish? And what's the color of your fish? Oh, wow, how many fishes have you caught from your friends? Like it turns the narrative into something much more fun. So when I take all this together, and if you recall my earlier point that there is an opportunity to educate, not just distract or pacify, I believe that the current way of doing things at that time could be better. There got to be a better way. And that's actually how I decided to start on my entrepreneurial journey.
No, that's such a great story to hear, and just I can imagine transforming that patient experience into a kid, seeing it from a kid's eyes. And I like the idea of transforming a bed into a boat. So is there anything else in the beginning, in your early days? So volunteering at the hospital, anything else that really went to the foundation of the solution that you created?
So I'm glad you asked, Ruth, because from the experience with the hospital, right, and I saw how children want to be seen as a person, as a child with their individuality, what they like to express themselves. So naturally, I went in the complete opposite direction. I actually went into the art classroom because in the hospital, it is sterile, it is highly controlled and structured. Whereas in the art classroom, it is relaxing, kids are expressive, it's also messy with newspapers and crayons and generally a more chaotic environment. But it is precisely in such an environment that I'm able to gain the maximum insights. Because if you think about it, if I have one environment, which is the hospital and it's controlled, and the other environment, which is relaxed and unstructured, and if I design for both scenarios, it means I'll be able to cover the middle ground when I design with both scenarios in mind. So it actually challenged me as a designer on how do I create a comprehensive solution. And I felt that this was very important to make sure that I cover what kids want, what kids need holistically. So I started from how they absorb information, where do they socialize, and how are they like when they're having fun, or even when they bicker, like when they are like having small bickers, what are the insights I can draw from that? Because that's human nature, right? It's a whole of the person, not a patient.
No, absolutely. It's so nice to hear this story looking back and see how it all comes together. So, and you have this great example of, as you were learning to walk in the shoes and see the world from a child's perspective, you have this great tic-tac-toe example that also fed into the early foundations. Can you talk a little bit about that as well?
Oh, gladly. So we know the rules of the game where we play tic-tac-toe. Yeah. As you can see right here, I mean, if you put dots, crosses and circles, 3 in a row across 3 in a row, right, across 3 squares. So I was actually playing with this boy in my classroom, and what happened was I was thinking if I should let him win. So I let him go first. And what this boy actually did, instead of drawing one small circle, this is what he did. He drew one big circle across the entire grid. And he turned to me and he declared, I won. And I just looked at him and I can't say he's wrong. Because if you think about it, he went above and beyond. He didn't just cover 3 squares, he covered 9 squares. So what I can tell you from this example is, if you see us as adults, when we look at something, we think about there should be a way of doing things. But if you actually think from children's eyes, they see things with a fresh perspective. So as adults, we start from limitations, but for children, they start from possibilities. So therein, I felt that it's the same thing with health literacy. Very often when we think about health educational materials, we think of an app or maybe a brochure, a printed material, or at best an animation. And I get that this kind of platforms, this kind of materials are highly easy to distribute and they are economically priced. But therein lies a challenge. We are already predetermining how it will come across. We are putting limitations on ourselves. Instead of thinking from the child's perspective or from the user's perspective, how do they actually absorb information? How do they think through things, and how do they process and act on information? Because at the end, we must really remember, our end goal is not just to inform. Our end goal is to empower. So we got to make sure whatever information we're transmitting is something that they can absorb and they can apply.
No, I love that. I mean, it's great to hear about your beginning, because what's really clear is the why was clear. Like there was a need, but also, as you said, standing in the audience shoes, whether it was in a hospital setting, outside of a hospital setting, I think we'll see further down the road, enabled you to create a solution that was really fit for purpose. And I love what you just said in terms of health literacy is not to inform, it's to empower. And that's exactly the way we want to go. So we've heard about the beginning and how you spent time with children in a hospital, spent time with children in an art class, and were inspired by their disruptive way of seeing things. So now, can we talk a little bit about the journey to where you discovered Rabbit Ray, the solution for children? Maybe you can share a little bit about how you came up with an idea of health literacy through a rabbit.
The rabbit, I'll go back then. So, but at the start, you can actually see that it was just a simple paper sketch, right? Like very scrappy, low-cost materials. And I get it, in hospitals, especially if you're a patient community group, or even within a hospital, you're running on very lean budget. So you really don't need much to start something innovative. Remember, even a balloon can change the narrative. Yeah. So what happened is in the art class, I wanted to find out what's their favorite animal. So instead of giving survey forms, I gave them worksheets with a few characters, a bear, a rabbit, a cat, and several others, to see which is their most popular character. And I told them, pick 2 or 3 characters, cut it up, and tell me what are the animals doing. So you can see the results. Some of them imagine like this boy, this Chinese boy, he imagined that there is a castle and the bear is like probably the superhero with a cape, and this very sweet rabbit in a pink dress. And then there's another boy who basically picked 3 bears and like having fun at the playground. But overwhelmingly, what I found was that most of the kids actually picked the rabbit. And I was very conscious in running this worksheet and drawing lessons across a multitude of children, not just one class, but at least 4 classes, because I wanted to make sure I had a good mixture. I have kids who are recent immigrants. I have kids who are 3rd generation locals in Singapore. And I also had a good mix of different cultures and races, but more importantly, socio-economical background as well. So some kids, they could have better, more resources, and some kids have less. I wanted to make sure I designed something that is friendly across the board and appeal to different ages.
No, thanks for sharing that. And so maybe I can come to exactly what the solution does, Rabbit Ray, in terms of the different procedures he helped kids understand. So how did you come up with, so you created this solution for kids, you knew what the outside was going to look like, but how did you know what the procedures were going to be that you were going to help children understand more about?
Right. So even right here in this middle picture, where you can see it's this fluffy bunny, it's basically hand-sewn, and we were testing the process. But in the first 2 pictures, that process was very critical because we were really interviewing the doctors and the nurses and basically asking them, what is the most excruciating process that you have to go through when you are trying to help children? And they gave me further a lot of feedback, which I incorporated into the next slide. So I will touch on that a little bit. But I'm going to share with you an anecdote of doctors with exasperation and nurses, what they share with me. So a nurse was actually telling me how some kids, they come in crying and you got to calm them down. And as a result, there is this lost time. And you have a long line in a clinic waiting, right? So you have to calm the kid down and finally you get to do the procedure. So that's extra time cost, manpower cost. If you put that together, that costs quite a lot of time. And another one was a doctor who, I remember when she first came in, she was like this look of frustration, and she related to me. A mom turned to the child and basically told the child, if you do not behave yourself, I will tell the doctor to poke you. And the doctor was so exasperated when she heard that, because she said by that statement, it made her sound like the bad guy. And so she turned to me and she said, the doctor in the private session I have with her, she said, you really got to build this rabbit race so children will understand I'm there to help them, not hurt them. So, so that was some of the motivation I had when I was working with the clinicians, and how we can actually turn the rabbit into a friend that will explain to the child. And another thing people I have to interview as well is parents, because they are often involved in the care of their children, right? But one common refrain I hear, a common sentiment I hear from parents is they feel very helpless. They feel like they can just bring the child to the clinic, make sure there's enough money, make sure there's somebody babysitting the sibling, and so on and so forth. But other than that, within the clinic itself, there's very little they can do as caregivers, right? They can't participate in the process of elevate the child's pain or helping the doctor. They just do not know what to do. They feel helpless. So if you think back about the classroom setting where learning is social, children learn by interaction. So it's important for me when I design it such that instead of waiting time, it becomes bonding time, because now the parent can participate in the process of explaining to the child what's really happening. So this was some of the key considerations that go into the design of the product.
No, that's great. And then I think it makes a lot of sense. And I really appreciate this idea of listening to all those involved, right? We all know that healthcare is never an individual's, it's something that an individual tackles rather, but it requires everyone, and particularly for a child, to bring in the parent, the nurses, the doctors, and the child themselves really makes sense. Maybe the question around the procedures that you decided to work on, because I know that was an important. Rabbit Ray can't cover every procedure, but can you tell us a little bit about that and how you saw the design in the solutions that you were offering?
Gladly. Thank you for asking. So Rabbit Ray primarily can do 4 procedures. The catheter, setting up of the IV drip, which is children's favorite because they really feel like a doctor when they're doing that. That's helpful for chemotherapy. And a blood draw process, where and finally vaccination, which we should all be, most of us should get some vaccination by now. So I'll draw your attention to the first 2, which is catheter and the blood draw. So when it comes to the catheter, to us we think like it's a tube, but actually it's so much more than that. So for kids who are in the children cancer wards, they often have to go through a PICC line, PICC, which is peripherally inserted central catheter, or they go through a Hickman line, which is similar to this picture, where basically they insert the line directly into the body, especially for delivering very, very strong medication. They don't do it through the vein. And usually this implant can be for extended period of time, as short as maybe 1 month, 2 months, or even much longer, depending on the procedure. So can you imagine for a child, they can't go swimming with this line. It feels really itchy. They want to pull it out. But what happens when they pull it out? And often it happens. When a child pulls it out, first they feel the pain. And secondly, the doctor, in order to continue with the medication, will have to have a new operation, reinsert the line carefully, and have an X-ray to make sure that the line is in the correct vein, delivering to the right body part. All this means extra costs. And this is additional cost, which I don't think any caregiver want to take on, right? Because it's already expensive delivering care. So through Rabbit Ray with the catheter, when you help the child understand by putting in the catheter itself into Rabbit Ray, the child will start to understand how difficult it is to actually get it in. And it opens up the conversation now, because now the child can ask questions like, oh, how is this helping me, blah, blah, blah. And then you can actually explain to a child why this is important for them. So the likelihood of the kid pulling it out is actually much lower. And I'll just give you another example. So let's talk about blood taking, right? I'm sure as adults here, most of us might have drawn blood for a regular health checkup at some point. And very often, they would tie a tonic tube into the middle of our arm, and they will put in with the vacutainer and will draw out really quickly the blood. That's because the vacutainer, or the test tube looking thing, has its partial vacuum. So it's able to draw out your blood really quickly. But we can't do that to a child's vein because children's veins are tiny. So if you have the partial vacuum environment from the vacutainer, it adds additional pressure, and this will cause the children's veins to collapse. So as a result, what they do is they will insert in a tiny catheter, and according to the child's natural blood flow, they will let it drip out. And that's how drip by drip, they collect sufficient blood samples for the blood tests. Can you imagine how long this would take? I'll give you the answer. It can take as little as 20 minutes to 2 hours just to collect enough blood sample. Have you ever tried to keep a kid still for 20 minutes or more? It's really difficult. So herein again is the strength of Rabbit Ray, because when you actually have the phlebotomy, the blood draw process where the child can actually insert a needle-free catheter into Rabbit Ray, we are actually able to show the liquid flowing out. And we are also able to show if it's high blood pressure, for example, higher blood pressure, it can flow out faster. If it's lower blood pressure, it can drip out slower. So that really helps the kid to understand, oh, this is what's going to happen. And it allows the child to have the opportunity to ask questions as to why am I doing this? Oh, is to actually see if you have red blood cells. We are going to take a blood test. Don't worry, you don't have to study for the test. The only thing you need to do is to stay still. Something like that. So it makes it more easy for the child to understand, anticipate, and mentally prepare themselves. So these are very critical things. And I'll just stop right here about what are some of the procedures that it covers and why you actually do that. But I felt what was most important is not just for the kid to be informed, but for the kid to be able to act on it and to participate in their own care.
Yeah, I know, absolutely. And you took the words right out of my mouth, because in the beginning we talked about health literacy is not just about understanding, but the ability to act on something and actually change your behavior. So I'm going to, I think just, seeing your journey and really how you've just elevated health understanding among children and their parents as well is pretty remarkable. And if you think about it, 10 years ago, you started here in Singapore, and now you're helping children in, I believe, 25 countries in 48 different hospitals, which is remarkable. Before we end, I would like to ask if you can share some of the stories that you've heard back from patients or physicians that have really inspired you on your journey to elevate health literacy.
Right. So one of the amazing stories I heard, I'll draw your attention to this last picture here. So this is a hospital in Tanzania, and they received rabbit ray through a paid donation. So a hospital in the US and the UK, they actually liked it so much, they actually pay and they donated this set to this Tanzania hospital. And the most heartwarming testimonials I received is when they wrote me an essay, and they basically said that not only are they using it to teach the kids, but because the country's literacy level is not really high, the parents themselves do not have much understanding about what is cancer treatment, what is regular blood draws, and more importantly, why do they need to come back for follow-up treatment? So they start to use rabbit ray to educate the parents as well. And this is also important because it helps parents to understand it's not as if you go one time to the clinic and the problem will be solved. You need to come regularly to check on your immune system, to give you regular controlled dosage so that your treatment will be complete. So they like that rabbit ray itself looks very friendly. It's neutral, it's gender neutral, it's also race neutral. So it's actually, and more importantly, it relies less on words, but more on hand actions and the participating experience. So it becomes very accessible, because if it was just words, they might have tripped up. They do not know how to read. We assume they know how to read, or they may not know how to understand certain words, but by actually using the actual materials, it becomes a very organic conversational understanding. So that's what they really like about it. And I think that's one great example. Another great example I had was when I was in Viva Foundation. Viva Foundation generously allowed me to present my work. And Dr. A. Kang, who is a lead oncologist in Myanmar's Yangon Children's Hospital, actually bought it on the spot. She bought it on the spot, and she gathered around 6 or 7 nurses. And as I was explaining to her the product, she was translating it live into Burmese language. And that really touched me, because I can't speak the language, but herein my rabbit is actually able to comfort children in languages and in lands and countries I've never been to. So that really touched me. And this is a picture that she sent me of her staff using it happily.
No, I think thank you so much, Esther, for being with us and sharing about your journey from standing in a patient's shoes, talking to physicians, all the way to actually developing a very creative solution to help elevate health literacy. What's interesting is you started out thinking this is for children, but it's amazing how it has helped nurses, parents, and even teachers in different parts of the world to really help different children understand different medical procedures. So thank you so much for being with us here today.
Thank you for having me. It's a pleasure, and I really appreciate this platform.
Sure. Thanks, Esther.
Thank you. Bye.
Bye. So there are some great takeaways from Esther's story of developing rabbit ray solution to help children understand medical procedures, and just a few that I'll end that have stuck with me. you know, what I love about her story is she really did the work up front to stand in the shoes of those she was trying to support, you know, and really understand the person beyond the patient. And in this case, it was children who, as we all know, are often the best teachers. I also love that she talks to HCPs or healthcare professionals, parents, nurses, to really understand the dilemmas of managing a disease, because that really led to, I think, a solution that was really fit for purpose. The other key takeaway from me is around disruptive thinking and being innovative. And if you think about what we're trying to do with health literacy, we're really trying to change behavior and drive understanding. And I think this calls for really creative and disruptive approaches. Who would have thought a rabbit could help a child understand not to pull their PICC line out, right? And thirdly, and it really comes back to even the theme of today, or the theme of the next 3 days, is about the power of partnerships. And I think even in Esther's situation, the solutions that she came up with are really because she worked with doctors, nurses, children and their parents to really come up with a good solution. So it really requires all of us at the table. And very much in line with us today, you know, we're all here at the table for the next 3 days, coming together to debate, discuss, and see how we can develop innovative solutions for patients through alliance and partnership.